Do you suffer from anal pruritus, otherwise known as itchy butt? Well, don't worry, it's very common and a lot of people experience this. Within this nervous system are these special C fibers, and these C fibers generate your urge to want to scratch and scratch and scratch. And then what can happen is you develop these breaks and tears in the skin that actually fires up those C fibers again, which actually stimulates you to want to scratch and scratch more. So it's really a vicious cycle that can happen here in the anus that causes you to itch, to scratch makes you itch, and so on and so forth. First thing I usually tell patients when they come see me is stop the offending agents and get on a nice high fiber diet and some fiber supplementation. In addition, if those things don't work, there are some additional medical options to do. Sometimes I'll give a short course of steroids, but that's in a very controlled fashion. Then there are some other products that we can actually paint around the anus. One of them is called Gentition Violet, and actually what it does is it slows down the process of those nerves. And finally, even though this sounds a little bit odd, there is an agent that we can tattoo into the anus that can also stop those nerve fibers. That's called methylene blue. I will say that is done for the very extreme cases. But the point is, I want you to know that there are options if you are experiencing this, and doing the dietary modifications and bowel habit modifications are not seem to be working for you.